Come on in.
I'm washing my hands. Hi, Mr. Hoffman, how are you?
I'm doing well, thank you.
My name is Nancy. I'm a nurse here at Harper. Are you feeling okay
I
today?
feel very good.
Good. I'm here today to do an assessment of your abdomen. So I'm going to start by asking you 2 questions.
Okay.
Any problems with your stomach or your bowels?
No, everything's working well, thanks.
Good. Any surgeries in the past?
I've never had one.
Ever have any heartburn?
Oh, occasionally, but it depends on what I eat.
Oh, okay. You don't take any medicine for
No.
heartburn?
No.
Okay, wonderful. All right, so we're going to start out by having you lay back, and I'm going to put your feet up. So if you lay down, and I'm going to look at your abdomen. I need to see your belly here.
Okay.
So I'm going to start by looking at the contour, and the contour is rounded. And then I'm going to come to the foot of the bed and look at the symmetry, and the abdomen is symmetrical. And then I'm going to come here and I'm going to look at the umbilicus, and I see that the umbilicus is inverted, and I do not see any drainage or ulcerations on the umbilicus. And particularly for females, you would want to note if there's a piercing, and certainly if there is a piercing, to document whether it's well healed, or there's any drainage or redness around that. I also am looking at the skin for any moles or surgical scars. This is a common place where you will find moles, so you do want to look for that, and any scars. Many people have had abdominal surgery, so you want to look for that too. Then I'm going to look for any movements. I see normal respiratory movements, and I also see the pulsations of the aorta right here in this area, just about 2 inches above the umbilicus, and that is normal as well. You're also looking for any waves of peristalsis. That would not be normal to see that. You would maybe see that in a situation where there was very hyperactive bowel sounds. All right, so that's our part of our inspection of the abdomen. We're going to move on now to auscultating the bowel sounds. So I use the diaphragm of the stethoscope, and I want to listen in all 4 quadrants. And as soon as I hear that gurgling, I can move on to the next location. And you will train your ears to hear the bowel sounds and to determine if they're hyperactive, hypoactive, or normal. So I heard bowel sounds in all 4 quadrants, and they were normal. Then I'm going to move on to listening to the vascular sounds. I'm going to listen for the aorta, 2 inches above the umbilicus. And then at that same level to each side, but listen to the renal arteries. And then the iliac arteries about 1 inch down from the umbilicus, and then 1 inch to the side. Normally you press very lightly with the bowel, but because the arteries are in the back, you're going to have to press a little more firmly. And I listen to both iliac arteries. It's very likely you will not hear any vascular sounds at all. It is possible in a patient that you might hear a pulse, but you should not hear any bruit. Then we're going to move on to palpation. Do you have any tenderness or pain in your abdomen?
I don't.
All right, if he did, I would leave that area for last. So I start with light palpation using the pads of my fingers, not like this, pads of my fingers in a rotary motion all over the whole abdomen. So you're going to press down with your fingers in many more spots than you did with your stethoscope. So let me know if you have any pain or tenderness with any of that. So you want your patient to be relaxed while you're doing this so that you really can feel the belly and not just the muscles there. Now I'm going to press a little bit more firmly to check your abdomen. So I'm going to press down a little bit more, about 5 to 8 centimeters, using still that circular motion. I'm feeling for any lumps or masses or any tenderness, anything abnormal. And I would document that his abdomen is soft, non-tender, and that there were no masses. All right. Very good, and that concludes the assessment of the abdomen.